Well, if you're experiencing pain in your wrist or your hand, is there a way to avoid surgery? Well, if not, there may be a way to at least have it done with little downtime. Dr. Michael Fitzmaurice he does a procedure with minimal downtime, and you say very less invasive than other types of procedures out there. First of all, welcome to Sonora Living Live.
Thank you.
Yes, good to have you here. First of all, we're talking about carpal tunnel syndrome, and I think a lot of people think, dispel this myth for me, you get it from typing too much. Is that true?
Most of the time we have no clue exactly what caused it, and that's actually a myth. It's just typing.
Really?
If you're predisposed to it, then certainly typing can aggravate it, but most of the time we can't isolate one cause. There's many causes that all contribute to it.
And how do you know you have it anyway, and what exactly is it then?
So I mean, the carpal tunnel is a tunnel that a nerve and 9 tendons go through, so it's a confined space, and so if there's pressure built up in that space, it cuts off the blood supply to the nerve, and you get symptoms. So that would be like numbness in the fingers, tingling, weakness, pain. Sometimes they can be very vague, and other times you may have all of these symptoms or just 1 or 2 or 3 of them.
Okay, so what is it that you do differently in order to treat carpal tunnel syndrome?
So we do an endoscopic technique called the Endotech system that we developed, and instead of a long incision along the palm, which can take 6 to 8 weeks of recovery, we go in with a single incision. It's less than a centimeter into the wrist, and with the camera we can see the nerve, the tendon, this thick ligament that's placing pressure on the nerve, and we can release all the pressure.
Oh, really? So how is this procedure that you do different than, maybe what others do, or when you say minimally invasive, it's and less downtime compared to what?
Yeah, so like less than 6 days people are working. I've had staff go back to work within 2 days, compared to 6 to 8 weeks with a long incision. So a portion of that is because of the incision itself. We deal with a small, less than centimeter incision, whereas the others are a very long incision on the palm. And the other component of that is we use a nerve supplement called Neurogen, which we developed. So we provide nutritional support, which enhances the recovery, decreases swelling. And then we also use regenerative medicine techniques, even like stem cells.
Really?
Coating them around the nerve, which improves the recovery process.
Once you have it, are you then prone to it again, or can you make it go away?
Yeah,
I guess is the question.
Well, yeah, you shouldn't have to suffer with it. I mean, we get a lot of professionals that their livelihood depends on their hands.
Oh, well, absolutely.
And they can't take 6 to 8 weeks off of work. So there's no reason to suffer with it. We can get you back to work less than a week. Absolutely. And their chance of recurrence is very low because of all these other components we use. Nutritional support, we use stem cell therapy, it prevents scar tissue. So the chance of this coming back is much lower than 1%. Compared to other techniques where you have a larger incision, there's scar tissue that can develop, and we see patients who have had these other open, old techniques, and we have to revise them. And
then you end up with other problems as a result of having a larger incision and scar tissue on top of it. When people, who is really a good candidate? Somebody's sitting at home going, my hand or my wrist kind of hurts. Give me somebody sitting at home experiencing what should come to you.
So if you're having any of these symptoms, numbness, weakness, pain, come on into the clinic and we can do an ultrasound examination in the office. We don't send you out for studies. We do the study right there.
Okay.
It takes 10 minutes. And we can tell if you do in fact have carpal tunnel syndrome. Then we can go over some treatment options. If you just had it within a couple weeks, you might be a candidate for some steroids or some splinting.
Okay.
But if it's been longer than that or it's more severe, then we might want to talk about surgery to get rid of these symptoms. There's no reason to suffer.
Absolutely, yeah. You shouldn't do that, especially with the new technology out there with less downtime. Dr. Fitzmaurice, thank you so much for coming on today and giving us all that information. And let me just tell you this, that Dr. Fitzmaurice is offering a free consultation to find out really if you do have carpal tunnel syndrome, or if you think you do. It's a Fitzmaurice Hand Institute. He's located at 19820, that's North 7th Street, Suite 115, that's in Phoenix. You can call to make your appointment for that free consultation at 480-719-4750, or learn more at fitzhand.com.